So now that you have administrative support, a strong interdisciplinary team, and you worked with the interdisciplinary team to develop solutions for potential problems, it's time to develop an appropriate program. So the fourth step is to develop an evidence-based preventative training program. If you were looking to implement a different type of intervention, for instance, if you were trying to get your baseball pitchers to perform pre-practice shoulder rehab, this would be the time to either find or develop a program that's effective while still operating in your given environment. For lower extremity injury, particularly ACL injuries, the FIFA 11 is incredibly popular in Europe and Canada, and it's been gaining popularity in other areas of the world in the last decade. This is a bit of a longer program, roughly 20 minutes in length, and each exercise has a 3-tier progression so that athletes can make exercises more challenging as needed. While FIFA 11 Plus has demonstrated great success with reducing injury rates in a variety of populations, the great news for clinicians is that there's no singular magic program, and there are a number of programs available that can address your clinical goals. That being said, while there's no magic program, there are certain components that we've previously described that should be included in a preventative training program in order to elicit those injury and performance benefits. The key components are flexibility, balance, agility, plyometrics, core strength, and sport-specific movement exercises. And similar to FIFA 11 Plus, there should be options to progress and regress exercises in order to address team-specific needs. So are you working with youth athletes who might be going through maturation and need a little bit of a regression of exercises? Or are you working with more collegiate and professional athletes where they have a bit more of the athleticism and strength development to where they can handle more complicated exercises? So now that we have an evidence-based preventative training program to work with, it's necessary to train the end users on how to implement the program effectively. So I first want to just talk about some semantics in the world of implementation. When we talk about the idea of behavior change, there are a few different levels of change and specific words that refer to different points. The first is adoption, and this means, does the team start implementing a preventative training program? So they previously did not use a preventative training program, and now they've decided to start a program and have made actions to begin making this a habit. The second term here is fidelity, which is the extent to which the program is followed. So the team has adopted the program and started performing it every single day, but are they doing it correctly? Remember, particularly with respect to lower extremity preventative training programs used as a warm-up, form and feedback quality are necessary for the benefits. So the degree to which people are doing the exercises correctly is very important. Lastly, the term maintenance is here, and this is the idea of long-term compliance. Are the athletes continuing to utilize the program over a period of multiple seasons? In other sports, there's only so much retained benefit, neuromuscular control, particularly if you're working with a youth population who are going through a growth and maturation phase. So if you work with older athletes, either collegiate or professional, they may not be going through maturation, but there are certain training phases where there will be periods of intensive training load, and it's important to continue to do preventative training programs, particularly when athletes are fatigued. So in order to promote adoption and fidelity and maintenance, how do we appropriately design a training plan? I see this as two different components. There's kind of the passive learning environment where you may want to provide educational materials, either web-based or by mail or another format. And then there's an in-person training component where you're really teaching those hands-on skills of identifying good form and providing feedback cues to athletes. For the in-person training sessions, there are a number of considerations when designing a workshop. Regardless of if you consider this as research, as a clinician, you would still be implementing an educational intervention, and it boils down to that question posed a few slides ago. What interventions or strategies work for whom, when, and under what circumstances? I'll discuss a few of the considerations that are common factors for planning an educational training session for this type of intervention, but please note that many of these considerations could be applied to a variety of interventions in a variety of settings. So the first one is, who are you training? Are these volunteer coaches with limited to no experience coaching this particular sport? are these collegiate coaches who have a good familiarity with spotting poor form and providing cues to athletes. This will help you to decide the what of the education intervention. What content are you including in order to persuade your audience? Do you need to focus on performance enhancement benefits, or should you include content regarding the negative impact of injuries down the line? So who you are speaking to will really determine what you should focus on. The second consideration is the timing of the workshop. A single preseason workshop can be an effective strategy, but for some settings, such as youth sport, it can be challenging to identify all of the coaches too far in advance, as many recreational organizations are still scrambling toward the beginning of the season to identify parents and volunteers to coach. So it may not be possible to conduct one preseason workshop several weeks before the start of practices. In that case, it may be more feasible to have a few options available to coaches or to conduct a workshop after the first week of the season. Lastly, there's this idea of a standardized workshop or a more tailored strategy, where tailored strategies have been really successful in health behavior science. But what exactly is the difference between a standardized and a tailored strategy? In this example, for a standardized workshop, I'll discuss implementing a preventative training program in youth soccer and basketball coaches. So a standardized educational workshop would have a singular, quote, curriculum that you present to any youth sport organization that you may encounter. In a high school setting, this might look like the soccer coach and the basketball coach are both receiving the same educational materials, and you could have them in a workshop together. On the other hand, a tailored workshop would be implementing some of those strategies we discussed earlier, where you might perform a setting-specific needs assessment in order to identify from the population of interest what are the barriers to implementation, what or whom may be the key facilitators, and what types of equipment or additional supports might the population need in order to be successful. To further connect back to previous steps, how does your organization define success, and how can you ensure that you're teaching in such a way that will optimize the chance for success? So once you've determined some setting-specific parameters, you can then streamline your educational content to optimize the time that you have with your captive audience by focusing on the information that matters the most to them. Some delivery of the educational techniques to consider, and again, these are just a few, are number one, discourse. So this is really the art and science of trying to promote communication. How do you get your audience to engage? There are certain, quote, talk moves that you can utilize in order to encourage open communication. Also, the social cognitive theory, and this is just to say that people need to understand a topic holistically, the positives and negatives, and then observe the behavior, and then actively practice the behavior in order to optimize a hands-on skill in an educational session. So when you're designing your workshop, consider building your session to address the different methods of teaching. And ultimately, we're all just trying our best, right? So being positive and making your target audience feel successful is crucial to encouraging this health behavior change. So now the sixth step of the framework that we will discuss is fidelity control. So as mentioned a bit earlier, the positive outcomes associated with preventative training programs are linked to fidelity. That is the target audience utilizing the program as prescribed and also with a minimal important dosage in order to elicit a desired change? So are they doing the exercises correctly? And also, are they doing the exercises enough that they're going to be able to develop the changes so that you can see a difference in their performance? So in order to track fidelity, there are a variety of strategies, and on the slide here is a fidelity score sheet developed by Pato and colleagues for some of the JUMP ACL work implementing preventative training programs for West Point cadets. So here they've defined what good form is composed of: platoon in the correct formation, instructors correctly demonstrating, and to the correct military cadence, which was a really important factor for the administration and the desire for platoon uniformity. And are the cadre mobile and providing that feedback that we know is so crucial in order to do the exercises correctly and maximize benefit? So next to the components that would define elements of fidelity is the scoring portion, and that is ultimately summed for a total score. The benefit of the scoring system is that you can provide some immediate feedback to those who are implementing the program and learning the procedures and the exercises so they can continuously improve the administration of the program. A catch-22 with feedback, however, is to not overwhelm people with the feedback. So providing fewer simple cues on ways to be even more successful will be more readily implemented and is more likely to bring a sustained change than if you throw the kitchen sink of things that they did wrong. So being a little bit selective on what you would like for them to work on next in order to improve the administration. Because again, sometimes people may think that they're not seeing positive outcomes with a preventative training program, and they may think that the program itself is ineffective, but it's not that the program is ineffective, it's a fault in the implementation, and it's a fault in the administration that is failing the program. And lastly, we are going to discuss the exit strategy. So a component of pre-planning an intervention is knowing what happens after the quote experts leave. So who will take on responsibility to facilitate the implementation of the program? How can metrics be put in place to ensure that the group is continuously reassessing progress and updating in order to optimize maintenance of the positive behavior change? This is a great time as clinicians to consider weaving continuous quality improvement initiatives into your practice. If you're less familiar with the quality improvement, I'd like to shamelessly plug another AT-STIL EBP CEU opportunity that are specifically on quality improvement projects. So that's the 7-step framework. Very useful if you're trying to implement a preventative training program or really any type of behavior change within your clinical practice. The considerations can be quite transferable. But I'd like to reiterate the importance of clear, consistent communication with your stakeholders. Pre-planning and routine check-ins to monitor practice and to accurately adapt the intervention to best fit the context are key elements that shouldn't be undervalued.